The Mako Robotic system is used for replacement of total knees, and also partial knees can also be utilized for total hip replacement. We use a preoperative CT scan of the patient's knee to make a virtual 3D model of the knee that allows us to create a plan preoperatively before we ever go into the operating room and plan the cuts that we're going to make. Intraoperatively, you can adjust and change those cuts and customize it to each individual patient's ligament tension, and it kind of results in perhaps a more natural feeling knee. The standard and conventional systems, which work well, kind of make the same cut for everyone. Everyone gets the same alignment and varus valgus and flexion extension, and everybody's probably not really the same. The ability to make these subtle, sometimes subtle adjustments really can result in a better feeling knee. I just think it's an exciting new step forward in joint replacements, and especially knees and also in hips, that maybe allows us to make it better for the patient, make it better experience and better recovery and better functional outcome.